Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center, reporting for the week of December 19th, 2022. After a brief update on COVID and the flu, I'll talk a bit about the COVID outbreak in China, what that might mean, and what we can do to be best prepared for the winter. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Here in Alameda County, we can see that cases continue to go up pretty significantly. When I reported last week, we were at about 4,800, now over 5,000 cases over the previous 14 days, which we know is a major undercount since most of the tests are happening at home or not at all. And when it comes to hospitalizations in Alameda County, unfortunately continue to increase. 1 week ago, we were at 154 in the hospital. Now we're at 192. It's going straight up. It is really close to where our peak was for the summertime wave, and we are sort of just getting into the winter. So this is definitely a difficult place to be starting from. We had 16 in the ICU 1 week ago. Now we have 28. So that's also something of concern because the ICU beds were staying a little bit flat, and now we are seeing that go up pretty significantly. So we'll continue to keep an eye on it. When we take a look at community transmission, we can see that over 91% of the country is in either high or substantial transmission of COVID. So this is definitely concerning. Of course, this is not the map that they want us to look at. They want us to look at the hospital admission and hospital capacity, which is what they call community levels. And we are in the medium level here in Alameda County, which is why we've seen mask requirements go back up in certain settings, as I reported last week. And we look at new hospital admissions with confirmed COVID in the United States. We can see that it's pretty much going up in all of the age categories. It's most significant in those over 70 years old. And I'll talk a little bit more about that in a bit. But this is concerning to see that it actually is upticking in every single age group. And when we look at the same thing in California, following a fairly similar pattern, this graph is showing Region 9, which includes the state of California. And when we look at COVID-19 deaths nationwide, we're still over 400 deaths per day. So once again, a concerning place to be as we head into our winter surge. Looking at our variant proportions, we're still at about 68%, 69% being BQ1 and BQ11 overall. Some regional differences in different areas, but this remains true in California as well. BQ1 went down just a tiny bit, not sure what that means. We'll have to just keep our eye open. We see that the XBB is increasing a little bit, but it's not doing any rapid displacing of the others. So we'll just continue to monitor this. As it relates to flu, so we're still seeing really high flu activity. We've got weekly hospitalizations that are pretty much higher than any other time since back in 2010, 2011 for this week of the season. But we are seeing the activity plateauing in some places, even declining a little bit in some places. So very hopeful that that trend will continue, but we look at past years, sometimes there's an early kind of little peak and then it comes down and then it goes back up. So this is just something we'll have to continue to monitor. But so far, we've already had at least 15 million folks get the flu and get sick with it. About 150,000 hospitalizations from flu already this season, and already with 9,300 deaths from flu. 30 of those were pediatric flu deaths. 9 of those occurred in just the week ending December 10th. The good news on the flu front is that this flu strain has been very well taken care of by the flu vaccine. So that's great news. That's not always the case. So of course, but you have to get vaccinated in order for this to be good news for you. So get the flu vaccine and you'll be pretty well protected from this year's flu strain. Also, all of the viral specimens that have been collected and evaluated so far this season have been susceptible to all of our antivirals that we use for influenza. So that is also good news. The somewhat of a concern came out just on December 14th, this health advisory notice that was giving guidance of how to prioritize antiviral treatment of flu, just in case we end up with a reduced availability of our antiviral drug. So there have been a number of reports to the CDC of not having the antivirals available in different areas. That has not been the case yet here in Alameda County based on what we're hearing from our public health department. But nonetheless, this health advisory notice is something to take note of because we don't want to be experiencing shortages, and it is just very, I think, exhausting and frustrating that during this whole pandemic, we have experienced all kinds of different shortages across the board, from PPE to just regular items being available on the shelf, to most recently over-the-counter medications have been becoming scarce in some areas and difficult to get a hold of, like fever reducers and things of that nature. And then now to have this health advisory notice in the middle of flu season about antiviral treatment for flu. So still talking about supply chains, still talking about shortages in a country of such wealth as the United States during our ongoing crisis. It just kind of adds insult to injury. And it's just something that I don't know if it's something we're just going to be having to get accustomed to, because we know that there is still worldwide outbreaks, worldwide disruption. And I guess that's a good segue to talking about what is going on right now in China. I'm sure we've all seen the headlines that are saying that China COVID wave could kill 1 million people. And really what seems to be behind this is that China has relaxed some of its strategies, some of its mitigation strategies. So the COVID containment measures that were being implemented up until now in China are currently being relaxed. And so although their vaccination rate, they report it being pretty high, their booster rate is low. Their infection rate is also low because they've had such strong mitigation measures. And so much of the modeling is looking really concerning. They seem to be having a significant outbreak, although there's quite a bit of variation between the different reports. There are, videos of the hospitals, of the funeral homes, and things of that nature showing a dramatic kind of increase of cases, hospitalizations, and deaths. But sometimes a little hard to kind of get our arms around the data. One thing we do know is that China uses different vaccines than ours. They primarily use the Sinovac. And when you look at the effectiveness of that vaccine, it does appear to have a lower effectiveness against the Omicron strains. And mind you, this vaccine is used in the many parts of the world, not only in China. So this is something that we probably will need to start paying a bit of attention to. They are talking about different strategies, including rolling out a fourth dose, but also many of the academics there in China have been talking about vaccine skepticism and how many folks had not gotten the vaccine up until now, or certainly not gotten the booster up until now. So they have some major campaigns going. Now it seems that they also have a little bit of waiting lists to get the vaccine. So a lot of these reports are just coming through the media and coming anecdotally, a little bit difficult to kind of really get our arms around what exactly is going on there. But there does seem to potentially be some issues with vaccine uptake, and certainly with booster uptake, particularly among elders in China. And so this is one of the resources that we use to look at modeling for different parts of the world. The link is in the post, and this is the Institute for Health Metrics and Evaluation, and they are an independent global health research center at the University of Washington, and they do quite a bit of modeling for around the world. So this was just one of the models. There are others. They all seem to be sort of corroborating the same thing, which is, over 1 million people predicted to potentially die between now and April in China. And you can see that this model uses a couple of different scenarios. So each of those lines is sort of what's predicted, but then also keeping in mind that if certain things were to be instituted, like, increased outpatient treatment or increased masking and so on, then those numbers might be a little bit different, but they're all looking pretty grim and very, very concerning. And so this is what all the headlines and all the news is about. It's about this current outbreak, and it's also about the predictions around the potential death toll. And so why should we be concerned? Well, first of all, because that is a very heavy death toll. And so that many people losing their lives, we've lost 1.1 million people here in the United States, and reportedly China has had much, much less death from COVID, even though they've been contending with it for a little longer than us. But they have really used a lot of strict mitigation strategies up until now. So the fact that they're relaxing them now some people are saying the outbreak started before they relaxed them. Either way, relaxing them is obviously going to increase them. And of course, relaxing mitigations while an outbreak has already started is not very sound policy. We've seen that right here in the Bay Area. We've seen that in other places where things are being dropped now, when actually, we should be implementing things during what we would consider respiratory virus season, or where we know we're likely to be heading into a winter surge. So the timing, either way, is unfortunate and could result in a very high death toll for China. So we will be continuing to watch that situation. But what does that mean for us here? And we know that it doesn't take long for different variants to evolve, particularly when there's high transmission. So if we're talking about 1 million people dying, we know that that means hundreds of millions of cases or more. And so this is what we are also worried about, is that with more transmission means more mutation, more opportunity for mutations to take hold and for new variants to emerge. So anytime there's a lot of transmission, this is one of our primary concerns. This is exactly how all of the mutations that we're contending with now have arisen. So this is something that we're going to be wanting to watch carefully. And fortunately, we have a lot more sequencing going on all over the world now than we did when this all started. And so hopefully we will be able to get some fair warning ahead of time if there is a new variant that might evade our protection that we might have from vaccines, prior immunity, or that might get around our treatments. So those are all things that we're going to need to be keeping a close eye on. And of course, a lot of folks in leadership and in the media and so forth have been talking about concerns around supply chain, since obviously we do rely on China for quite a bit. So that's not my area of expertise, but I just got done complaining about supply chain issues that have been plaguing us throughout this. Without China experiencing massive outbreaks that's impacting the health of their population. So this is, again, just something that we are contending with, as if we needed another reminder. We are still in an active, evolving pandemic. This is not what endemic looks like. This is an active, evolving pandemic, and unfortunately, we are still continuing to contend with so many different aspects of it. So what do we do about it? Well, I mentioned that part of the vulnerability of the Chinese population does appear to be relatively low booster uptake. Well, guess what? Our booster uptake is really low here too. And so only a small percentage of our population is boosted, even those who are most vulnerable. So even those over 65 years of age, we've only got 35.7% boosted. And then look at all these other age groups. It is pretty pathetically low. So 14, 15, 16% of the population being boosted with the updated bivalent booster. So what is going on with that? Well, I think, all of us were rightly sort of questioning how important is this another booster? Why do I need to do this? Do I need to do this? And so I am glad to say that we've actually got some effectiveness data recently in that is very impressive and compelling, and I hope will get folks off of the fence and realizing that it is important. So we understand the theory behind it. We know that on September 1st, so just a few months ago, the Advisory Committee on Immunization Practices, so that committee that advises the CDC, recommended the bivalent COVID-19 boosters, either Moderna or Pfizer, that were developed against not only the original, the ancestral strain, but also against Omicron, the BA4 and BA5 sublineages. Now, that's not exactly the main sublineages that we're dealing with now. Like I mentioned, we're dealing with mostly the BQs. And so that was one of the reasons why I think folks had questions. Well, is this going to really give me the protection that makes any difference compared to the boosters I got before? And this recommendation was for anyone who had completed at least their primary COVID-19 vaccination series. Well, we've got a couple of studies now that do demonstrate effectiveness, and this is very, very reassuring. So first off, I'm really impressed that we got this early data, because it's only been a few months since it came out. And sometimes I feel like we've had to wait and wait and wait. And so I'm pleased that there is some early release of data that has been published. And so that in and of itself is important. But also the results themselves are quite reassuring, because I don't think any of us could say with certainty how much this is going to help us. But now I think we've got some good evidence. So I'm just going to quickly refer to it. I put the links in the post in case you're interested in looking at the actual studies. These were both published in the Morbidity and Mortality Weekly reports. And bottom line of the two studies, the first one really was looking at those over 65 years of age. And it basically showed that the bivalent booster provided 73% added protection against COVID-19 hospitalization compared with the monovalent mRNA vaccine. So 73% added protection. This is really important. And this was looking at those over 65. So only 35% of our over 65-year-olds have gotten this booster. We need to make that closer to the 80-90% that we saw with the primary series. This group in particular, those over 65 years of age, is who we are mostly worried about in terms of hospitalization and death, especially if it's been more than 6 months since they had their last COVID vaccination. So if it's been more than 2 months since they've had COVID, then it's time to get the Omicron booster if you haven't gotten the Omicron booster yet. And apparently that is over 60% of the population that's over 65 years old. So if you know somebody, you care about somebody, please encourage them to go ahead and get the Omicron booster. The second study looked at emergency room, urgent care, and hospitalizations. And it basically showed that the protection against hospitalization was 57% higher if you compared with no vaccination, and 45% protection if you compared it with having had your last shot more than 11 months ago. So if you haven't had vaccination for over 11 months, then it's kind of worn off to the point where getting this Omicron booster will significantly increase your protection against hospitalization and emergency department use. And this is protecting against the current strains that we're dealing with now. So that is super, super reassuring. And so the CDC MMWR put out this sort of infographic here. An updated booster may reduce your risk of severe COVID by 50% or more. And then it has all the little asterisks and things down there. But if you really want to see what they're basing this on and what that average is, you can take a look at the links that are in the post to these MMWRs. And if you're someone who wants to hear other folks besides the CDC, And, that's understandable. But the UK Health Security Agency also puts out a COVID-19 vaccine surveillance report. They update it when they get new information. I've also linked that one in the post. And that one was also very, very reassuring and quite consistent with what we're seeing here, basically saying that the effectiveness, which they measure as they call incremental protection. So how much benefit do you get on top of what you had from before? And what they looked at was people who had their last vaccination more than 6 months ago. So they've had waning protection for over 6 months. And the incremental benefit from getting the bivalent vaccine compared to those with that waned immunity over 6 months was 57%. So very consistent, quite significant. And like I said, more than 400 people a day are still dying from COVID-19. And we really want to see that go down to nothing if we can. And I think between getting an updated booster and getting outpatient treatment, if you catch it, we should be able to bring that down quite significantly. So if you have not had the bivalent booster yet, and you haven't had COVID, caught COVID in the last 2 months, then now is a perfect time to get the Omicron booster. Actually, you will have fabulous protection through the winter wave if you get the Omicron booster now. So don't delay. Let's do this before you start mixing around for the holidays and so forth. Let's do this before we start seeing peaks in cases, hospitalization, and death. Let's get it done now, and you'll have great protection throughout the winter wave. There's just no reason to be waiting. If you wait until springtime, well, that doesn't make sense, because we're facing our most difficult weeks and months coming up now. So through the winter. So get your protection now. Definitely get it before you start traveling. And this goes for the little ones too, because the little ones, and I know a lot of parents have had questions about this, but we want to protect them. You saw the hospitalization graph. Every single age group has increases in hospitalization. And actually, after the elder age group, the next highest age group in hospitalization is the 0 to 17-year-olds. And they have the lowest protection because we are not getting them vaccinated at the rates that we could or should be. And so the little ones, for their own protection, we want to get them boosted. And the boosters have been approved for the littlest ones. And of course, if you are pregnant, the way that you get the baby protected for their first 6 months of life when they're not eligible for the vaccine is pregnant moms, please get vaccinated as well. That gives protection to your baby all the way up to 6 months of age. So this is helpful for them. And also, if our little ones are going to go visit family, they're visiting grandma and auntie and uncles and so forth, we don't want them giving COVID to them either. And although the vaccine doesn't stop transmission, it does reduce the likelihood of you catching COVID, you spreading COVID, having a bad outcome from COVID, and so on. And if you're confused about who is ready to get the booster, and with little ones, it is a bit confusing, so I don't blame you. There is this tool that I've showed you here before, which is the booster tool that tells you if you're due. It's quite handy. You just click on it, your age group, which ones you got before, when you got them before, and it will tell you what you're eligible for, what you're due for, and what you should do next. So the link to that booster checker is in the post. And so I'd encourage you to check it out if you're not sure if you're due yet. If you are due, just go ahead and get it. It's time. So what else can we do? Well, we can definitely implement home testing into our holiday plans. And the government is giving away 4 more free at-home COVID tests. I'm hearing that they are shipping pretty quickly. So order them now and you may get them in time for your holiday activities. If not, please otherwise get them. You can purchase them. You can come and get free ones. We have plenty of them at Roots. Please come on by or email us at admin@rootsclinic.org, and we'll make sure that we have those ready for you to pick up. Either way, we want to make sure that you have an ample supply of at-home tests in case you get symptoms, in case you get exposed, but also how about incorporating them just as one additional layer to any household gatherings or other gatherings that you might be having. and have attendees test before coming to your gathering, and then we can exclude people who are positive. And certainly if you are going to be traveling or otherwise in indoor environments, especially where others are not masking, which unfortunately is a lot of indoor places right now, which means you are one-way masking. So if you are indoors, you're at the airport, or otherwise need to be indoors, you are one-way masking. And what does that mean? It means you need a high quality filtration mask, like an N95 preferably, that fits you very well, that is well sealed, so that you can protect yourself from the obviously ample amount of COVID that is currently swirling around in our environment, not to mention flu, RSV, parainfluenza, metapneumovirus, and a number of other respiratory viruses. But certainly we want to make sure that you are protecting yourself from COVID and from flu in particular, and that if you are someone who should get treated, if you catch COVID or if you catch flu, please have a treatment plan. And we know that we now have 3 approved treatments. So know which one you would get, how you're going to get it, where you're going to get it, what if your doctor's on vacation, when you get it. Let's get that plan all worked out now, before you really need it, because when you're not feeling well is not the time to be scrambling around for this. And if you are going to be gathering with folks, we want to make sure that indoor ventilation is as good as possible. That might mean opening windows, it might mean running your HVAC system, it might mean HEPA filters, or all of the above. Also, we want to try to center the gathering as much as possible outdoors instead of indoors. Depending on where you are, that might mean fire pits, that might mean outdoor heaters, but certainly crowding indoors in a poorly ventilated environment is a recipe for a super spreader event. We're already hearing about super spreader events. We're already hearing post-Thanksgiving of super spreader events and some of these holiday gatherings where multiple people are coming out positive. Is it worth it? We've talked about not only the acute infection, but cumulative infection. I went in depth in this a couple of weeks ago, so please check it out if you have not checked it out. But basically, there is quite a bit of evidence that is demonstrating that repeat infection is not a good idea. So if you've caught it once, let's not catch it a second time. You've caught it twice, let's not catch it a third time, and so on. If you are going to be in small spaces, like let's say in the car, a good idea to mask up and open up those windows. And if you do need to be indoors, or you're going to be indoors, then don't linger too long, or consider, like I said, masking up. For some gatherings, it may be appropriate to have areas like the restroom or where you're serving food. Maybe those are the mask areas. And so those are things to definitely consider if you are going to be gathering over the holidays. And one thing I always mention is, if you are going to have a gathering, please keep a guest list. You want to be able to call folks promptly if someone comes back positive, and just create that culture of caring, where you care enough about one another to let each other know if someone comes out positive, and then we're going to call and let everyone else know, so that, especially if there's someone who should get treated, you only got a 5-day window. So we need to act quickly when this happens and make sure that everyone is aware. Of course, it's better to prevent catching it in the first place, but we know that the treatments are reducing the risk of hospitalization and death by somewhere around 80%. So really important to timely get access to treatment if you do turn out positive. And last but not least, if you don't have a primary care provider, please hurry up and get one. Make sure you know how to reach them before you need them. And maintain a balanced diet, get some good nutrition, get some exercise, manage your stress levels, consider a multivitamin supplement with additional vitamin D, and get a good night's sleep. Thank you so much for joining us. If you have any questions or feedback, please email those to admin@rootsclinic.org or direct message us. And we look forward to seeing you next Tuesday at 10 a.m. See you then.